This episode of Wellness with Delaney is sponsored by Zen Principle. We all know the feeling. It's 10 a.m. and that first cup of coffee is starting to wear off. Cue the crashing energy levels and total lack of focus. So you find yourself reaching for a second cup just to take the edge off. And then around mid-afternoon, you start to feel that same familiar crash coming on. So you reach for your third. And then suddenly you realize you are stuck in a doom cycle of chugging more and more coffee just to make it through the day until you're on edge, jittery, and wishing there was a better way. Me personally, yeah, I've been there, but I recently found a solution that not only gives me that burst of energy that I so badly want, but it actually supports all day energy and focus without the crash and without the jitters. Meet Zentelligence Ultra Focus Nootropic Supplement. This comprehensive 8-in-1 formula supports cognitive function through multiple pathways, targeting focus, memory, energy, and mood support. Featuring powerhouse nootropics like organic lion's mane, alpine galangal extract, acetylcholine, ginkgo biloba, water hyssop, L-theanine, and caffeine from green coffee bean extract. This supplement right here is a simple but powerful way to battle daily brain fog in the short term while also working in the long term to support the longevity of your cognitive health. So where a cup of coffee might give you a burst of energy for 2 hours followed by that horrible dreaded crash, Zentelligence provides up to 5 whole hours of balanced and focused energy completely crash and jitter free. As a busy health and wellness coach, content creator, and podcaster, I just don't have time to feel exhausted. So Zentelligence Ultra Focus Nootropic Supplement has everything I need for better energy, helping me maximize my productivity, but most importantly, doing so naturally and without anything artificial or shady. As a very holistic ingredients freak, this is something that I actually feel good about. And here's the deal. Unlike so many other supplements out there, Zentelligence is research-backed, using very clearly disclosed dosages for optimal transparency, and it's made in the USA in a GMP certified facility, which is basically a fancy way of saying it undergoes the highest level of scrutiny and standards to make sure you're actually getting the highest quality ingredients and benefits. So what the heck are you waiting for? Break up with that afternoon crash and shop Zentelligence using Delaney for 15% off. The link is in my show notes, so make sure to check it out and start giving your brain what it really wants. Welcome back to Wellness with Delaney. Today we have on a familiar face. This is Madison Tylak of Tallow Twins, but one thing you might not know about her is she's also a birth worker, and that's actually where her background is. And so I brought her on the show today. We're going to talk all about pregnancy, the journey of pregnancy, how to have a beautiful, healthy, glowing pregnancy, all the different just interventions and options and things out there, and really just kind of what it looks like to embrace the really holistic ancestral path when it comes to bringing new life into the world. So if you are thinking about conceiving someday, if you're currently in the trenches or you're pregnant or just whatever it is, this is a great episode for you to tune in. We're going to talk so much about what it looks like to embrace every single stage of life. So Madison, thank you so much for joining.
Thank you for inviting me again. I'm so pumped to talk about all things birth. This is the one conversation that no matter what time of day, who I'm talking to, the moment we start talking about all things birth, pregnancy, just like the whole radical side of things, I will take you down a rabbit hole, and we will be here for a minute. So I'm so pumped to just see what comes up today.
Oh my gosh, I love that. I'm so excited. Okay, so first of all, people might like off the bat be like, okay, what's a birth worker? Like, how is that different from a doula or a midwife? Like, what do you do that's a little bit different than what people might see on the internet or at most clinics?
So I call myself a radical birth keeper. Basically, it is another fancy term for an unregulated midwife. Legally, I cannot call myself a midwife because I don't have a medical background and I'm not registered as a regulated midwife. So that's where the term radical birth keeper comes in. And you may also hear traditional birth attendant, traditional birth companion, sovereign birth attendant, like all these different names. Honestly, call me a birth fairy. It doesn't matter. What I'm doing is supporting women that are choosing to birth outside of the system without any regulated medical birth worker, like an OBGYN or regulated midwife. And basically, we're doing things a little bit more traditional and sovereign. Unassisted, that's another one that you will hear often. Unassisted means no one's doing anything. It's just we're witnessing the woman give birth. And I am there as a doula figure, but also just a wise woman with tools and skills and just the energy, which honestly people are like, oh, that's a little bit woo woo, but it is so not spoken about enough how integral it is to have the energy and the space in your birth realm, wherever you are, whatever type of birth that you're having. The energies is a big one and something that cannot be glazed over. It's what quite literally supports the woman to produce the primary hormone that she needs to have a successful birth, oxytocin. So that is a little bit about my job. I currently support families that it's typically just mom and dad and me. Maybe there's a doula. Maybe there's another TBA or RBK present, but that's pretty much it. And we're just kind of hanging out, having our babies at home. Typically, I'm supporting women that are having wild pregnancies, which also means that they're not experiencing any relationship with the system, doing blood tests, ultrasounds, any of the wild things that they're asking women to do, like drink a liter of this sugar juice so we can see if you have gestational diabetes, all the
Mhm.
things. We'll get into that, but that is what a radical birth keeper is in a nutshell.
I love this. Yeah, and even so for me, I haven't told you this, but I've been going through like the Christian hypnobirthing like
Oh,
process,
beautiful.
and I finished the book. And what was so crazy to me, like you're mentioning the energy, people will hear that and be like, oh, energy, woo woo, whatever. It's like, no, literally who you have in the room with you, whether your desires are met, you feel autonomous, you feel like your needs are being met, all these things like literally impact the hormones that can make or break like a really positive birth experience. And I don't think people realize that. So that's what always blows my mind when people are like, okay, in a hospital, bright fluorescent lights, beeping, monitors, students, like there might even be like residents like running in and out, people running around, like being just jarring. And I'm like, no wonder people are having so many interventions when they don't necessarily need them. It's an extremely stressful situation. I personally don't want to put myself in that situation. I'd much rather let oxytocin take over and let my body take over. So I'm really glad that you're doing what you're doing and really educating women on the physiological birth process. So I would love to know, how did you even get into birth working, or I guess birth keeping?
So for me, ever since I was a little girl, I spent a lot of time on the farm and going to a goat farm specifically.
Cute.
And I think I was about, I don't know, between 5 and 7 years old. We were spending a lot of time at this goat farm. And I was just obsessed with, obviously playing with baby goats. Who the heck
I'm
isn't?
still obsessed with it.
They're the best.
Yeah.
But more particularly, I was really loving witnessing the goats give birth. And I just thought it was so beautiful and miraculous. And pregnant mama goats were just, oh my gosh, they had my heart. And, my parents and family thought it was like, oh, this is just like a cute little thing that she likes. And then I started saying that I wanted to become a baby doctor. Obviously, this term has evolved. Um, and I have found my way after very many, many years of pondering where and how I can fit into this birth world. But yeah, in high school, I studied my butt off so I could get into the midwifery schools. And I applied to every midwifery school in Canada. There's only 3 at the time. And I didn't get into any of them because they weren't accepting immature students. I was 17 years old and I'm like, I'm ready to be a midwife. And they're like, you're 17 years old. So that didn't work out for me. And I was just devastated. I didn't have a plan B. I'm like, that's what I want to do. I had a bunch of counter offers for like biomedical science and health science and nursing. And they're like, listen, if you take an undergrad in nursing or whatever the heck you want to do, then you can apply to midwifery in 4 years. And I'm like, what? That was my first experience with the system that I was just so aggravated at. I was like, why is it that I need to jump through all these hoops to do what I know I'm supposed to do and to support women during birth? In hindsight, this was the greatest blessing of all times. I didn't see it at the time, but God really does have a plan. And although I was devastated in that moment, a few years later, I ended up just taking time off. I was working, I traveled to Asia, And then I got home and then I started a doula course. This was 3 years later. 3 years later? Around there. And so I did that and then immediately started working as a doula when I was about 22 years old, so 4 years ago. And it was just dream come true. I'm like, this is what it was. This was always what was meant to happen. And so my first and second birth were both home births with regulated midwives, what I wanted to be so badly. And I supported these two births and I was devastated. I was like, something is off. Something feels wrong. This isn't right. Why does it feel like this? Why are these midwives treating the association that they're regulated by in a higher hierarchy in comparison to the women that they're supporting? Like when it comes to where their loyalty lies, it was their license and the association and the protocol and not the women. And it was so clear. Like I had not seen human birth before up until this point. And it was just so evident to me that these women were asking me to like advocate for them and to basically be their birth bodyguard. And I'm like, what the heck? This is not how it's supposed to be. There's something broken here. And so I supported home births with midwives and hospital births with midwives and OBs. So I supported every type of variation of birth, including cesareans, being able to be in the room while it was all going down. And I'm like, I feel the trauma. I'm going home traumatized. What is going on? Like this is my heart's work. This is my passion. This is what I was meant to do. And why do I feel this way? Yada, yada, yada. A couple years ago, I made the decision that I was no longer going to support births at the hospital and only select births with regulated midwives at home because there was a broken system and I did not believe in it. And so I kind of started leaning towards the radical sovereign out of system route where women were basically free birthing. Honestly, free birth, just to clarify, everyone's like, well, what's a free birth versus a birth with a radical birth keeper? Technically, the definition of free birth is a woman is birthing alone without any hired help. So if you hire a doula, you hire a birth keeper, it's technically not a free birth. It doesn't matter what the heck you call it. This woman is birthing. She's having a sovereign unassisted birth. Call it whatever you want, whatever feels good for you. That's what I tell my clients. It doesn't matter what the name of it is called. But and that is when I started studying with the Free Birth Society to do their Radical Birth Keeper School. And that was amazing. It was with Emily Saldea and Yolanda Norris Clark, both incredible people in the space to follow and to learn from. And then from then on, I have been only supporting out-of-system births, and it's been so cool and beautiful. Like this is what it was all for. This is where I was meant to be. And I get to be the woman, the sister, the mother to the mother that gets invited to these births. And I just get to make them snacks and soup and broth and set up the candles and make the vibe and the ambiance really beautiful. And that is my primary role, honestly. Like, that's it.
I love that. Oh my gosh, what are you doing in May? Come down here. But no, and I think it's so cool too, because when you start your passion by witnessing animal births, right? And you see how with a very few radical cases, they're unassisted, the animal knows what to do. And then it eats the placenta and then it like immediately breast like it's just easy, like it knows what to do. There are obviously very few cases where someone might need to intervene, but like in general it's not a medical emergency when an animal gets pregnant and gives birth. So this is something that's been starting to like rub me the wrong way in the past few years, is like, why do we treat normal healthy pregnancies like medical emergencies?
Money. Birth is an incredible business. If we weren't filming a birth podcast right now and we were filming a business podcast, and I would have a very, very different things to say right now, because it's an incredible business.
Yeah.
Everyone's doing it. Everyone's giving birth. And what better way to capitalize on creating a space where these women don't feel safe, they feel as though that they need to refer out for absolutely everything, starting with the moment that you're pregnant. Come in, let's do an ultrasound, let's make sure everything's okay. Because immediately, hot out of the gates, a human body just conceived a child on its own. There was no doctors on standby when you conceived this child or did anything to make this pregnancy come to life. And now all of a sudden it's like, I need to take a very good look at you every X amount of weeks until this baby is born, starting with measuring absolutely everything: baby's heart rate, your heart rate, fluids, measurement, quite literally like measuring your belly. I'm not sure if you've done this
I
already.
have not. I don't think they honestly, because I'm not going the OB route. I don't think
Okay.
that will be happening. And also, I have a really holistic midwife who's literally like, you don't even need to weigh yourself if you don't want to. And I'm like, thank you. Like, thank you
Yeah.
so much.
Yeah, absolutely unnecessary. It's just
Mm-hmm.
so many numbers. And it's like, how could we possibly make pregnancy and birth be a one size fits all experience? Like every
Yeah.
single woman is going to have a very different experience every single time. Even the same woman with subsequent pregnancies,
Mm-hmm.
it's going to be different. But yeah, an incredible business it sets you up to believe like, oh, well, I need to go do my wellness check. I need
Yeah.
to go do my prenatal visit. And then that is kind of making us believe immediately hot out of the gates that there's something innately or inherently wrong with us. Like we are sick. Like we need to have someone outside of our bodies tell us that all's good, baby's healthy. And
Mm-hmm.
oh my God, a whole rabbit hole alone is to talk about the amount of times that these doctors and ultrasounds will diagnose things that never actually come to fruition. Like, oh yeah, we should pull the plug on this pregnancy because we're seeing this. And then the baby comes 10 months later and all is beautiful and perfect and wonderful. So
And how many
it,
babies are aborted because of a false diagnosis? I actually just had someone on the podcast where the doctors told her parents, and she shared this on the show, that there was a 99% chance she'd have Down syndrome, and they heavily, heavily encouraged them to abort, which, okay, honestly, eugenics. Like, I don't really, my big thing is like informed consent, autonomy. Like, if somebody wants to do genetic testing, like, if that's truly your heart's desire, don't let me stop you.
yeah,
But if you're doing it to decide if you're going to keep a baby, you are a eugenist. It's giving like Nazi Germany, in my opinion.
yeah.
And it's super ableist, right? And so they're like 99% chance going to have Down syndrome. You really should consider aborting and trying again. And then they find out like months and months later, right before she's born, that like they actually read the results wrong. And it was 99% chance doesn't have Down syndrome. Born super healthy, amazing woman. Like literally, she had just adopted and like is an awesome person. But I'm like, oh my gosh, you almost, if the parents had listened to the doctors and nurses, like she wouldn't even be alive today. Crazy.
It's just so heartbreaking that this is something that is happening every single day.
Yeah.
It's unbelievable. And yeah, there's just a number of things that we could go on and on and on and talk about of just the amount of claims that are made within the hospital throughout this woman's experience, just throughout pregnancy alone. And the anatomy scan, or we're measuring too big, we're measuring too small. But it's like, who the heck are we to say? Where are these
Yeah.
numbers that we're pulling out of quite literally thin air to
Mm-hmm.
say that this is the standard? And if you're even a tiny bit above or below, that you are now deemed a high risk pregnancy, which that comes with its own beautiful set of intervention that they will move forward with. Because at the end of the day, autonomy in the hospital, that's an interesting discussion, because although we technically have it, I mean, you're in a high risk environment where they are strictly trained to support high risk pregnancies, real medical emergencies. And heaven forbid, I am not over here anti hospital. There is a time and a place, and I am so grateful that it exists. But I'll tell you what, healthy pregnancy and healthy women that are having normal pregnancies and normal births, I believe it is much more dangerous to birth inside the hospital than it is at home.
Mm-hmm.
Completely.
Oh, I fully agree. I mean, you're increasing your risk of intervention because they want you in and out the door. Even like how many inductions happen right before Christmas because doctors are too lazy to come in on Christmas Day when it's like you didn't need to do that and you probably just honestly traumatized yourself in your birth experience. And it's not really the fault of the mothers because I really do think like there is such an education gap because doctors will tell you this is the way to go. It's the safest thing to do because they are taught in their medical schools all these corporatized ideologies, right?
Yeah.
And they're paid more for more interventions. Like there's so many things there people get mad at me. I mean, I just got in trouble, like a lot of trouble, for a post I did about my thoughts on epidurals. And listen, I'm like, do what you want to do, but why are we, there's this whole culture now of, I see women on the internet being like, I want the epidural upon hospital arrival, and then I want a glass of champagne welcoming me after birth, and da 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 da. And it's like, and you don't get a trophy or a gold star if you do a natural birth. And I'm like, we're, those of us who are going for a natural birth are not doing it for a gold star. Like, we're not doing it for a
No.
trophy. I don't honestly give a crap what other people think of my birth story when it happens. The reason I'm doing what I'm doing is for my baby and for myself, because
Mhm.
I want the most oxytocin. I want better breastfeeding. I want to decrease risk of forceps and vacuum and emergency C-section and all these things. Like, I want a sacred birth experience. I'm like, I don't care. This isn't about a gold star. This is not about a trophy. And then people are like, oh, you're shaming other women. It's like, no,
No.
literally don't care what you do, but this is the truth, and the truth is crazy in a world full of lies. Let me tell you that.
Yeah.
So let's talk a little bit about interventions, because
Mhm.
there are a lot of interventions, and a lot of women, honestly, if they're told by a doctor to do something, they're just going to do it because they trust their doctors. And that's where my heart really is for the women, with like, without judgment. I just want to bring that education forward so people can at least make informed decisions. So let's talk about, first of all, like inductions, because that's a big one, like starting everything. A lot of women like start their labor process with Pitocin. What actually happens in the body when a labor is induced?
So, just thinking about what the word induced means and what an induction is. So, an induction happens when a woman isn't in labor and their birth team, whoever, whether it be a midwife or an OB, they want the labor to get started. So, they're inducing labor. This is not a physiological labor. The body has not gone into labor on its own. So there's a bunch of different variations of induction that can take place. First and foremost, the one that typically happens first is something called a stretch and sweep. So during a cervical exam, they'll basically let you know how dilated you are. Which, full disclosure, I am anti-cervical exam. There's no way to sugarcoat that.
Mm-hmm.
I don't believe anyone needs to enter the woman's body other than the man that got her pregnant, period.
Yeah.
I will die on that hill. Moving forward. So during a cervical exam, while they're checking your cervix to see how dilated you are, to see how soft and stretchy and ripe your cervix is, they will go in and they will basically stretch it and sweep along the
Ow.
cervix. It's so uncomfortable. I've
That does
never
not
had
sound
one.
pleasant.
Obviously, I've never had one, but it's not pleasant at all. And every single woman that I've ever heard that has ever received one always, without fail, will say, I will never get another one of those again. If you're hearing this and you've had one, I am sorry. And I'm sure you never got one again if you had other pregnancies afterwards. So that's number one. Then typically a woman will go home because labor doesn't happen immediately. She will go home and things will definitely become crampy. And a lot of the times this can influence prodromal labor, which is basically our bodies cramping long before true early active labor begins. It just can feel crampy. You could potentially lose your mucus plug, which is that nice, beautiful protective mucus that sits inside of your cervix to make sure that no bacteria gets up to where baby is. So these are all things that can happen. If labor doesn't kickstart from there, which it normally doesn't, and if it does, it's like I cramped uncomfortably for 5 days until my body actually got into gear, which is just like that wouldn't have happened. Maybe you would have just had a normal 5 days of nourishment and feeling good, and then on the 5th day you just go into spontaneous natural labor. That
Mm-hmm.
is an ideal circumstance. Typically, if that's what they're doing already, they are wanting to kickstart an induction quicker. So they will tell you, like, come in the next day or the following day. And then we're going to do step two. Step two typically is a gel that is inserted inside of your cervix. And it has something called prostaglandins in it, which is a hormone that basically allows our bodies to relax and open and dilate and soften. So we actually produce, as women, we produce higher amounts of prostaglandins during our period. Think about the shedding and releasing of all the blood during our period. And also, the girls will get this, period poops. It doesn't just release what is happening in our uterus and cervix. It is releasing everything. So that is why you can feel like maybe you have a softer stool throughout your period. Thank your prostaglandins when this experience is happening during your menstrual cycle. Where did they get the prostaglandins? Where is the synthetic version coming from? Well, it's actually coming from pig semen, which is
Ew.
just, yeah, it's disgusting. I know.
Oh my God.
Um, and in my opinion, if you want to go the natural, holistic route, if you're pregnant as heck and you're like, I really want to encourage labor to happen on its own, this is where we invite the man that got you pregnant, and his semen has prostaglandins in it. So when I tell my clients this, they're like, they get a little shy. I'm like, no, seriously, like be intimate. Talk about oxytocin helps influence natural labor. The prostaglandins in semen helps support and influence spontaneous natural labor, all these
Mm-hmm.
things. So do
Like
that
have them
rather
play with your
than,
boobs too, like nipple stimulation, all these things, right? That people don't know. But pig semen, ew,
I
in
know
your
it's,
like in your vagina, essentially.
yeah, it
I'm
directly
gagging.
in your vagina. Yeah, it's disgusting. It's horrific. After that, step 3, we have the Foley catheter balloon, and it is exactly what it sounds like. It's basically a catheter that goes in your cervix, and it's a balloon that stretches your cervix to about 3 centimeters, which the balloon is about this big, and it goes in and it will fall out once your body reaches 3 centimeters. It is as uncomfortable as it sounds. And they'll send you home with it, and it's just like inside of you, and it's really uncomfortable. Not an ideal circumstance. Once this balloon falls out, typically women, because they're manually stretched to this 3 centimeters against their body's will, they'll typically just stay there and think about like how uncomfortable your body must feel, and like you get really tense and clench up. Well, our body is doing that all on the inside as well. So after that, they'll go to the hospital. At that point in time, you're officially deemed as like failure to progress. Start the oxytocin. And so this is the beginning of the end. Once a woman receives oxytocin, which is protocol for every single birth, pre, post, during, all of the above. If you don't make it very clear that you don't want to receive oxytocin, and even if you do, sometimes they don't even care or listen, and they'll give it to you anyways. I have unfortunately seen this a number of times. But yeah, the beginning of the end. This is it's actually called Pitocin, not oxytocin. It's a synthetic version of the natural thing that we produce. And it doesn't cross the blood-brain barrier like the natural hormone that our pituitary gland produces. So what happens from then on is just a disaster. Our contractions are way more intense, way faster, and shorter periods in between the contractions, which influences a woman to experience a labor that is beyond a physiological norm. So then she almost needs a pain relief because they're not normal. She's not meant to have contractions like that. So it's not because she's weak. It's not because, she wanted to go the medicated route. It's because if you or I, two very holistic gals, received oxytocin throughout a labor, we'd probably be begging for the epidural
Wow.
because
And
it's
you don't
not
have like the
normal.
natural pain relief, right? From like the beta endorphins and the oxytocin, how like your own natural hormones are literally like taking morphine, right? But you don't
Mhm.
get that from Pitocin.
Yep. Hmm.
Wow.
So yeah, insert epidural or other pain relief. Epidural obviously is like the beginning of the end, chapter 2. And it's just so tough because now women are forced to be in a position that they would never elect to go there themselves, with their legs open, lying on their back, and it is just unbelievable. And not to mention that there's fentanyl in
Mm-hmm.
epidurals. So we don't even need to go
Yeah.
down that rabbit hole, but we'll just
Already
leave
did
that.
that, got in so much trouble, girl.
Who
But
got
it's
you in
true.
trouble? What the heck happened?
Apparently, I'm a mom shamer for saying the truth. This is what I'm saying. Like, all I said is it has fentanyl. People are like, you're shaming moms. And like, the truth hurts.
Read the ingredients.
Read the insert, girly. Like, the truth
Yeah.
hurts. I'm sorry.
And I feel for these women. I've supported these women that are like, there is no way over my dead body will I receive an epidural. And then they receive oxytocin and they're going through it and there's no other choice. It's sad. It's
Yeah.
heartbreaking.
Yeah. Okay. So before we move into like the next steps of what happens with interventions and epidurals and everything, I know a common rebuttal people are going to have, or a common question they'll have at the very least is like, but what about the risk of stillbirth increasing after 40 weeks? That's what my doctor tells me. Do you have any information on whether this is valid, whether it's a real concern?
Oh boy, I love this question. Yeah, it's true. The percentage of stillbirth doubles from 0.001 to 0.002.
Uh,
They
but there'll be
just
like
left that part out.
100% increase, right? But it's
Yes, it
marginal.
doubles. And it does. But let's talk about that is true informed consent. And for people that talk about consent, like what is consent? Like I said, yes, that I would receive the medication. Like that's consent, right? But it's like, did they tell you the risks of
Mm-hmm.
receiving the medication? Or did they tell you the risks that would happen if you didn't receive the medication that is incentivized to receive said medication? And it's typically that one
Yep.
because it's like if you don't receive this, and I hate I hate speaking these words, but it is unfortunately something that I have heard hundreds of times. The dead baby card. Doctors will look at you in your face while you are going through the most vulnerable and sacred and difficult experience of your life, childbirth, and say, if you don't do this, your baby will die. And I've heard them say things like along the lines of, if we delay cord clamping, your baby will die.
What?
If you don't receive this, your baby will die. If we don't do this, if I don't give you X amount of cervical exams and I don't know what's going on in there, your baby could die. I'm telling you, they use this card. I don't, over my dead body, I don't think I have ever supported a hospital birth where those words weren't uttered. At least 1 to 3 times.
Let's just insert fear. And I mean, okay, inserting fear. Let's say you have a woman who's like not going into labor. If you increase her cortisol, she's so much less likely to go into labor too naturally, right? Like you're literally hindering the biological, the physiological birth process when you're stressing a woman out. I feel like the fear tactics are insane. It's one thing to be like, hey, here's the pros, here's the cons. Like even with my midwife, she was like, hey, if you don't have to do the glucose test. Just so you know, if there was an emergency and you had to go to the hospital, they will treat you like you have gestational diabetes if you don't. Choice is up to you. Like we talk about the pros and cons of both, and I've never felt afraid, right? I never felt like I have to make a decision now or my baby's gonna die. And that's how it should be. It's like, hey, here's the research on this side, here's the research on this side. You decide.
Yeah. No,
That's all it should
completely.
be.
Yeah, it's pretty heartbreaking that women are put in this box and in this situation where it's like, listen, if you don't say yes to whatever the heck that we want to do, I'm going to scare you into saying yes no matter what. And
Yeah.
I have supported a lot of families. They're like, very very like-minded to us, but they're like, you know what? It's our first baby. We just feel more comfortable birthing in the hospital. Like I don't have a problem with saying no or to advocate for ourselves, but I'm like, I don't know how to explain it, but I'll try. No matter where your mind, body, soul, heart is, no matter how educated you are, no matter how much information and studies that you read prior to, when you're in that moment, you haven't slept for 3 days, you're exhausted, you're going through a decent amount of pain, hence being in labor for say 3 days. They will pull out all the stops and there is no talking your way out of it. And honestly, you're on their territory. You're on their playing grounds. I jokingly will say, like, you don't go to the barber shop to get your tires changed. So if you want a physiological birth, don't go to the hospital. Don't go to the hospital. I'm sorry. I am not negating the women that have deep intuition with their bodies in pregnancies and births where they feel as though something is wrong. I'm like, that is your guiding light. You listen to that always. I will never be a human, a birth worker that will tell a woman like, no, you don't need to go to the hospital. You don't need, if she genuinely wants to go. Because they know best. Like there is no greater jurisdiction in a birth other than the woman that is giving birth. She is the pilot of the ship. She is making all the calls, and this is how it should be. This is what it looks like with births that I support. And in the hospital, that is just not ever going to be the case, no matter what you know, no matter what type of advocate, no matter who's your doula is. believe, like, I have supported many hospital births where the doctors pretty much look at me like I'm a peasant, hippie, freaking just deadbeat that doesn't have a critical thinking brain cell in my head. Like, they will look at me that way, and it doesn't bother me. But I try to explain to my clients, I'm like, look, it's not what you think, and I don't want to be another experience of the fear tactics and the fear mongering and being another person in their life, because the hospital's already doing a great job of scaring the absolute shit out of them. I don't want to do that on the opposite side, but I also want to be really clear and honest about what the experience is like in there. And I can't exaggerate it enough. And it's devastating. And I have spent many days post hospital births coming home just crying because I'm like, that is not fair what happened. This woman was having a normal, healthy, beautiful birth that was ripped out of her hands against her will. And I, to my core, don't believe that any of the things that were done were necessary.
Yeah. Oh, fully agree. I mean, and I haven't obviously been in a position of witnessing, but the more stories I see and stories I read, I'm like, to me, the hospital is reserved for emergencies, and that's it. And my pregnancy from start to this point has not been an emergency. It has been a healthy, normal pregnancy. And that, like, people are so shocked. Even I'll have women all the time like, so what hospital are you giving birth in? Who's your OB? Like, assuming. And it's funny how that's the culture now, that if you're not doing that, like, it's like surprising where people actually assume, like, even my grandma was like flabbergasted when she found out I was not giving birth in a hospital. And she's like, why? And I'm like, knowing me, I would be an OB's worst nightmare. They would hate me, and I would frankly strongly dislike them. And we would fight about every little decision until I was worn down and stressed. And I don't see how that's conducive to a healthy pregnancy and a healthy birth and like mental health. And she's like, oh, okay. And I'm like, I don't really need someone like trying to pressure me into doing a bunch of things I've already decided I don't want to do.
Mm-hmm. Yeah, exactly. That makes perfect sense. I love that. And there are so many women that have this information and they're like, I know what it is that I want to experience for my birth. And for the women that are able to just take their responsibility. And this is a very big conversation in like the sovereign birth world, because it is not to say that birth doesn't have risk, but I will say that driving your car to the grocery store is a lot more risky in regards to the chances of you dying than it is you giving any variation of childbirth.
Mm-hmm.
And while we're on the topic of statistics, any variation of a C-section, you're 4 times more likely to die amidst this insane operation than you are in any variation of childbirth, whether that be breech, whether that be OP, or any variation of vaginal birth, period. So it's just crazy. And so it's really beautiful to see women, back to responsibility, taking full responsibility for the experience that they're having and going the more sovereign, maybe out of system, maybe traditional midwifery. I know it's very different in the US as well. In Canada, it's OB, regulated midwife, and that's it. There's no other options. And it's covered by something called OHIP here in Canada. So it's like we don't have to pay out of pocket to, obviously, for either option. We're all paying for it. It's just it's not out of pocket.
Yeah.
So for me, my clients are finding me and paying me under the table, cash, whatever, and I am supporting them at home. So
yeah,
it's crazy. And these are the women that, are taking responsibility for their births. They're not saying, okay, I get to have this birth because Madison's there and she's going to take care of me and she's going to tell me what I'm going to do and she's going to tell me when something's wrong or when something is good and blah, 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 blah. That's not at all the experience. I am there as a witness. I have tools and wisdom and experience. And because I'm a human being, if I see that something is wrong, I'm going to communicate that. Or say a baby needs some help after a baby has arrived. I have taken a newborn resuscitation course, and I will practice those tools if I need them because I'm a human with integrity.
Yeah.
But that is all. I am like truly the vibe police.
I love it.
It's the most important part.
I love this. And now, okay, before we move back to epidurals too, you mentioned like the C-section risk being higher than even with the risk associated with like breech or anything else. And this is what's so frustrating to me. And I'm curious what you think. Because like so in the US, every state has a different regulation and rule and law. That's kind of the deal with the states. Like they get to decide. But of course, living in Washington, where everything is just insanely, it's funny, it's liberal, which actually means just more control. But I was asking my midwife, like, hey, if the baby is breech, can I still give birth with you? And legally, they are not allowed to deliver breech babies. So my options would be completely unassisted birth or C-section. And I'm like, I do want someone in there for my first time. Like, I would like someone in there who's experienced birth, who knows what to look for, right? And like my husband is studying right now, he's like studying like daddy doula stuff. That's great. But personally, I'd like someone with me who, and my midwives really do respect me, and I do really like that. It's like is a lot of sovereignty there, but like also their hands are tied, right?
Mm-hmm, mm-hmm.
And so I'm like, it puts women in this horrible position of like, okay, you either are completely on your own, whether or not you want to be, or you're going under the knife. And that's something
Yeah,
even now at 21 weeks that's stressing me out a lot. And so I'm like, okay, well, I need to like get the birth ball and start doing like the spinning babies exercise just in case, because I'm like, I don't
yeah,
want to be put in the position of having to choose.
yeah.
Is it actually that risky to deliver a breech baby vaginally?
So, in simple terms, I want to say no, because some babies are just meant to be born breech. There's a handful of them that are born breech all the time, every single day, totally fine and safe. Is there more risk involved? Absolutely, yes. Physiologically speaking, babies are built to be born head first with their face pointing towards your bum. So basically, their back is on, like if the baby was still inside of you, when you're touching your belly, you would be feeling the spine of baby. That's ideal positioning for baby. If you've ever heard someone say that they have back labor or their baby was posterior, basically flip baby. Now baby's spine is on your spine, still head down, but think about the contractions of, baby's spine on your spine. They can be a little bit more uncomfortable. So now obviously breech means feet first. There's a bunch of different variations of breech. There could be like bum first breech, feet first breech, one leg down, one leg up. So there's a bunch of different variations to speak about there. And yes, there is more risk involved, because when babies are coming out bum first or feet first, there is more likelihood of the cord being entrapped or pressured. And obviously that's where they're receiving all their oxygen and blood from, the blood with the oxygen in it. And so this can be a little bit more risky. That being said, there has been numerous births at home, unassisted, where they have all gone incredibly well. I have never supported one myself. One of my best friends in the space, she has supported two breech babies at home as a traditional birth attendant. And yeah, both were great and normal. There are women that only give birth to breech babies. Is it the shape of her pelvis? Is it the shape of her uterus? I don't know, but for whatever reason, we can't outsmart our body's innate design. And that is like such a big one, about like honestly a very foundational belief that I have with all things birth related. I will never think that I know more than the woman's body or the baby.
Mm-hmm.
And even this is such a common one about, or before I go there, I'll finish the conversation about the breech. There is a traveling conference that goes around from the US and Canada called Breech Without Borders. And it's basically an association where a bunch of birth workers have gotten together, both regulated and unregulated, and they talk about breech birth methods and stuff, because they don't teach this in medical school. That's why it's like immediately C-section. We're not trained for this, because again, cha-ching, like, oh, awesome, this baby's breech. We don't even need to go there. Let's just cut
Yeah.
her open. But there are trainings that you can do within Breech Without Borders. And then there's another doctor named Dr. Stu. He is an OBGYN, and he talks a lot about breech birth. And he actually speaks at the Breech Without Borders conference. And this is an incredible tool and source for people, not tool, a source for people to learn more about breech births And unfortunately, when your hands are tied in your situation, say baby is presenting breech, and they say like, look, we're hands off. I will no longer support you. I legally can't support you. You can still give birth at home to your breech baby. Obviously, you'd probably want a little bit support because that would be intense. And also, I've heard it can feel a little bit more painful again because the way that the head is shaped, it's like it's all meant to slowly stretch and open the woman's body.
Mhm.
And then obviously having the head last can also be a little bit of a more dangerous situation because heads can get trapped really easily. And it's typically on the back of the occiput, the bottom of our skull can get hooked onto the pelvis. And there's a bunch of different maneuvers and tools that people that are trained in breech birth can maneuver and support at a home birth. And so it exists. Unfortunately, a lot of the midwives just aren't trained to do it. But yeah, there are people. And another fun thing about breech presenting babies, a baby can look breech and be bum down or feet down for an extended period of time, and in labor can flip and go
Wow.
head down. So it's interesting when people are getting scans at 37 weeks, 38 weeks, and their baby is breech, and they're like, yep, let's book your cesarean for next week or on 40 weeks on the dot.
Mhm.
Meanwhile, like baby's probably going to flip. And yeah,
Yeah.
doing spinning babies. And there's another one called the Miles Circuit. It's like an hour long. And it's just like a bunch of different movements that woman can do. So yeah, again, we can't outsmart the body no matter how much we try at the end of the day. It knows what it's doing, and we can't simply pretend that we know more than what our body knows and our baby knows. Because again, they could be doing that for whatever reason that they need to be there. Maybe they have a short cord. I don't know. A number of things that we don't know and we don't need to know, because like when you have innate trust in physiological birth, it just works, especially when
Yeah.
you are hands off.
Absolutely. Yeah, no, that totally makes sense. And I'm hoping, I mean, it sounds cool that like there are doctors and midwives and birth keepers coming together to bring education around this, because ultimately that's what's needed to change the narrative and at least give people options. Because I know people like myself, like I would much rather have a physiological birth, and like I'm too soon to even know, right? But I like there is that level of stress of like, okay, well, I don't want to be put in this position of having to decide just because I won't have anyone there. And
Mm-hmm.
so, and like, luckily, I'm hoping it never even comes to that. But if it does, I like want to be prepared and know like what's gonna. So my big thing right now is like just trying to like do all the right exercises and honestly pray. Like my MO has been like pray for my ideal labor, because I feel like people actually kind of neglect the spiritual component. To me, it makes a lot of sense. Okay, so moving it back into epidurals, because this is
Mm-hmm.
important. So we left off with epidurals have fentanyl. Okay, so some people are like, but that doesn't affect the baby. It only goes into the epidural place in the spine, da 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 da. What's the truth behind this?
So obviously, if you think about where baby's blood is coming from, it's coming from the placenta. And the placenta is attached to the inside of the uterus of the woman. And so obviously there is a great blood exchange there. And whatever mom is going through, whatever mom is eating, whatever mom is injected with, baby is experiencing the same thing. So same as epidural and the Pitocin that women are injected with and hooked up to an IV. Babies are experiencing and receiving that via blood, and it is the same as the woman experiencing the medication and the Pitocin. So for Pitocin, babies typically will have fluctuations with their heart rate, and you will hear doctors say that baby's like, oh, heart rate is too high or heart rate is too low, blah, 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 blah. Typically, this is very common and can happen quite frequently when women receive the Pitocin. Same as the epidural. So doctors will say something very casually along these lines of, towards the end of labor, we actually want to slowly reduce the amount that you're receiving via epidural, which, if you don't know this, basically it's a needle that goes into your spine and it's hooked up just like an IV bag. And via this IV goes directly into your spine. And the whole point of it is that it will numb or paralyze you from the point in which that it is inserted downwards. It has happened where for some women it only works on one side of their body, or one leg, or one literal square inch of their body. Like I had one woman, a previous birth that I was not present at, she said there was about a piece of her leg like this size that she couldn't feel, but everything else she felt.
What on earth?
So many crazy things. And there's a lot of epidural injury that happens as well. So that's a whole thing. Anyway, going back to the epidural, doctors will say that towards the end of labor, they actually want to minimize the dosage of the epidural going into the woman because babies come out a little bit sleepy.
Mm-hmm.
I'm like,
So
wow,
the
you
baby's
really,
high.
I'm like, yeah, you made that sound really cute, but what does that mean? Baby is a little bit sleepy.
Mm-hmm.
Exactly. Yeah. Baby is on drugs. And so, heaven forbid, don't eat oysters during your pregnancy, but let's give you fentanyl during your labor. It's like,
Checks out.
what are we talking? What's going on?
It's crazy. Well, then, because if you have an epidural, right, you have to give birth on your back because you're paralyzed if it's successful.
Mm-hmm.
So between that and the fact that you can't feel labor and a successful epidural, what does that do for risks of tearing, episiotomy, forceps, like all the other different interventions?
The percentages of any of those things are exponentially increased. Think about what a contraction is. It's basically your uterus is tightening and squeezing and trying to bring your baby down. There's something called your fundus. You can't really see it here, but your fundus, it's kind of right below your boobs. And this is a thick piece of tissue that also slowly like comes down throughout labor. And with the help of the uterus contracting, it's expelling baby, alongside with gravity is super helpful, and also your cervix ripening, baby engaging. All of these things are super important. It's like the beautiful cascade of what childbirth is. And so when this is happening, our babies are obviously doing a whole bunch of things in little tiny movements called the 7 cardinal movements, where basically they tuck their chin, they get the skinniest part of their head, and they are moving through the pelvis. Movement is really helpful to make this happen. When we have an epidural, we can't move, and you're locked into a position. Typically, we got one nurse on this side, one nurse on this side. We got our legs cranked open. Maybe you have your feet in the stirrups. Like, it's the whole 9 yards. And when we do this, anatomically speaking, the pelvic outlet is the smallest that it will be when we are in this position, which is not at all helpful. Actually, very counterintuitive. So that is when we're going to need to, episiotomy, which is basically them cutting the tissues to allow there to be more space for baby to come out. B, yes, without the episiotomy and with both situations, the amount of tearing is absolutely increased because the woman she can't feel the contractions. She doesn't know when she's contracting. She doesn't know when to push. We only push during a contraction. The little break in between is a little break. Just have a breather. Do what you got to do. And so, yeah, when a woman doesn't know when to push, she can push too hard. She can push too long. And it's not ideal. And thinking about as well what a contraction is doing to baby, it's squeezing baby's little home. Like, baby's already like, oh, this is a little uncomfortable. This is already a little bit traumatic, even in the most ideal physiological state. Now we're increasing Pitocin, all the yummy ingredients in an epidural. And so, of course, baby is going through it. But baby is going through it. It is not ideal. And then, yeah, insert forceps, insert vacuum, insert hands, literal hands of the
Ugh.
doctors going inside of you, pulling out your baby.
God forbid. And then does that increase the risk of C-section as well? Because I feel like now just the whole labor process is disrupted.
Oh, absolutely. Yeah. The moment that baby is like showing signs of distress, they're pretty quick to throw in the towel, being like, yep, emergency C-section. And because it's an emergency C-section, moms are now put out so they don't get to meet their baby and hear their baby cry and kiss their baby and have their baby put on their chest. It's
Mm-hmm.
the whole situation is just very, very traumatic and not at all what birth was meant to be. Physiologically
Yeah.
speaking, like we are going against every single grain here.
Yeah. Okay, so then for somebody who's, let's say, even doing an unmedicated birth, let's like in any birth scenario, do you have an issue with coached pushing?
Yeah.
So tell me about this, because I think a lot of people just push when the doctor or the midwife says to push.
Mm-hmm. You'll know when to push. The most common thing that I hear when the baby, it's time for a woman to push, they will say, Madison, I have to poo. And I'm like, okay, you don't actually have to poo. It's probably your baby, but yeah, try to poo.
Yeah.
And they're like, no, like this is definitely poo. And I'm like, okay. So
See what
you will
happens.
know.
Yeah.
You will think of this conversation when you're in labor, when you're in the depths of it, and all of a sudden you have a strong urge to poo. That is likely your baby. And it feels very similar. Like you don't have someone come into the washroom with you when it's time to, have your daily poo, do you? Okay,
Mm-hmm.
Delaney, you're going to take a big breath here. Ready? You're going to push your poo out now. It's like,
Yep. 10
yeah,
seconds.
I have the urge. I know I can't, I walk to the
Yeah.
washroom on my own. Like that's why I came here. Birth is the same, girls. Like we do not need to freaking overcomplicate it. It is a physiological process that our body knows how to do instinctually, intuitively, all the above. It is a primal action. You will know when you need to push. And even though in the hospital settings as well, I want to tie this in, even though that women are 10 centimeters, green means go, it is time, you can push now. But it's like, okay, but like I don't really have the urge. It's like, okay, listen to that. It's not a green flag. Like, yep, the numbers align. The
Yeah.
stars are aligning. It's time to push. No, that's not at all what happens at
Yeah.
all.
We've been giving birth since the beginning of time. It's not that complicated. So for women, okay, so we have like obviously, the stage 1 of labor where it's like your contractions ideally at home. And then we have the transition, and then we have like the down labor. It's like, okay, it's go time. I've read in that transition period, that's when women are most likely to request an epidural because they might get like really overwhelmed, a big rush of adrenaline, like making them feel like they can't do it. Do you have any encouragement for women in that phase when they might be like more likely to request an epidural because they just get really overwhelmed?
Yeah. So this transition period is so common, even with completely out of system home births where we don't even have options for pain
Mm-hmm.
relief or epidural. It is so common for women to be like, yep, I changed my mind. What the heck was I thinking? Let's get to the hospital. I need relief. And at that point in time, I will literally look at the woman and be like, babe, you're already there. This is the hardest part. Like this is the dark hour of the night. You've already done it. The hardest part is here, and honestly, it's almost over.
Mm-hmm.
This is a very, very, very common experience. Honestly, very few births I've supported, I didn't hear these words. And if I didn't hear them, they were still probably thought, they just weren't verbally voiced.
Right.
So just hold on. Like that is the point. And if you need encouragement, think about what this is all for. You weren't skiing and you broke your leg and this pain sucks. This pain is very different. It is purposeful pain. And if you just think about what it is that we're doing here and what it is all for, you get to meet your baby in a little while. Like you get to meet your baby soon. Take a breather and offer the support, whatever it be. And sometimes it's nothing at all. Sometimes it's just being there and say, I know this sucks. This feels uncomfortable. It feels impossible, but it's not. And you will do it and you will get through it just like every woman before you and all the women after you. And you get to meet your baby soon. And that's it. It's honestly so, so beautiful.
Yeah. So do you think in these cases, because what I would imagine, and this is obviously as somebody who hasn't gone through birth, but just kind of thinking through my own goals, but like in those cases, if you know that might be a weakness, I feel like it would be really important to like tell, like whether it's your husband, your mom, your doula, whoever's there to support you, like tell them, hey, in this season, in this specific moment, I might ask for an epidural. Remind me I don't want one. Like encourage me. Like, do you think it's important to kind of coach whoever your birth partner is on that plan so that they can be like, sis, no, you don't want it?
Oh, absolutely. 100%. These are definitely conversations that I would like to have with a woman prior to birth, just so I can really understand like what are non-negotiables for you. It's really important to get on the same page there with whoever that is going to be in your birth space, so they know what it is that you want and what you really don't want, and things that you're likely going to say. And I like to have these conversations with women ahead of time, just saying like, look, you're probably going to say this. And they'll be like, oh, no, I won't. No, I won't. And I'm like, if you do, just know it's normal.
Mhm.
We can move on. We don't have to sit here. We don't have to manifest this at all. But just know that it is normal and it's uncomfortable. And the most beautiful thing that we can do for ourselves is, in what way can we increase oxytocin in this space? Because as we know about all those wonderful hormones that mitigate the pain, come from all the happy, awesome, comforting, safe feelings, whether that be lighting, whether that be sound, smell. Like these three things are so unbelievably important in the birth space that people just don't even consider, because I mean, we have a massive list of like, I need to fight for my life so they don't give me all these drugs, but it's like, shall we not forget about sound, smell, and then visuals,
Yeah.
lighting, the art, whatever it is that's in your space, having a little birth altar. If you're at the hospital, you can shut off the lights. You can bring 24 flameless candles. You can, well, they're going to say that you can't, but I still do it. Go in and like spray a little bit of a gentle essential oil to like make it smell a little bit less like
Mhm.
a hospital. But for those that are birthing at home, oh my gosh, the world is your oyster. Make your birth sanctuary a sanctuary and give
Yeah.
yourself so many options of, if I want to be in the living room, this is where I'll be. If I want to be in the bathroom, this is where I'll be. This is what I'll have set up. I'll have pillows everywhere. I'll have a shower curtain underneath a sheet on the bed to protect the mattress. I have my options. Like, this is my birth playground. And it's a beautiful way to just like really set yourself up for great success in that department.
Oh yeah. I know people always think I'm crazy because I tell them, and like I'm not sure if I'm gonna do a home birth or a birth center yet, just because we're very likely moving right before the baby's born. So I'm like,
Oh, wow.
I'm leaving my options open because I feel like if I pigeonhole myself, I'm like, I'm doing a home birth and we're not set up, like we're not fully moved or whatever. Like I just want to be in a mindset that's flexible, right? Like
Mhm.
in that case, like that's flexible and knows how to problem solve versus panic if things aren't exactly how I want them.
Yes, I
But
think
I'm
that's
like,
so great.
in my ideal birth scenario, I tell people like I want my dog there. And they're like, that's so crazy, unsanitary, like you can't control. And I'm like, no, you don't understand. Like, there's nothing at this point on this earth that gives me the oxytocin boost that snuggling my dog does. Like, and
Oh,
I feel like even for like stage 1 labor, like for all the up labor, like I feel like the thing that's going to progress it the best is hanging out with my dog, because literally I just like whenever I'm stressed I just like hold her and I'm immediately like get like that cuteness overload. And so I tell people that and they're like, oh, who's going to watch your dog? I'm like, well, ideally me, but
yeah.
we'll see what happens. That's like my dream. And I know that if that doesn't happen for this birth, like for future births, that's 100% what I want. Like she is for sure my unregistered, but like she is my ESA in so many ways. Like she really is like my emotional support creature. So, okay. So I want to talk about also like after birth happens. In a lot of cases, the first thing, the doctor takes the baby away, measures them, bathes them, yada, yada, before like bringing them back to you. Why would that be traumatic for a baby to not have immediate skin to skin? And also, like, why wouldn't you want to bathe a baby right away?
So baby has absolutely no clue that they are a part of the mother. They need the mother's skin, the mother's heartbeat, the mother's smell to regulate their blood sugar, their heart rate, their temperature, their everything, their nervous system. There is absolutely no difference to the baby that they are anything separate from their mother. And when baby is experiencing absolutely anything out of the norm, the first thing above anything on the planet Earth that would support baby more is being on their mother's chest. And this is why it's also so important during birth that you're not wearing a bra. Like, I'm talking immediately bra off, naked skin. The baby needs to be able to see and smell your breast milk, the colostrum that is waiting to nourish baby. This is a non-negotiable. And so yeah, within the hospital setting, like absolutely not is the baby detaching. And this is also why, hello, again, physiologically speaking, how incredibly beautifully wise that our bodies are. Baby's literally attached to us. The placenta is still inside of me and the cord attached at this point, post birth, and the cord from the placenta goes to baby's belly button. So baby's not supposed to leave the mother's hands, body, touch. They are still connected after the baby is born. This is not a fluke. Cutting that cord immediately is incredibly problematic in so many departments. A, because 1/3 of blood is still inside the placenta. That is baby's blood, which belongs to the baby, obviously. And also, baby cannot be away from the mom. And so that is first and foremost a non-negotiable in any situation. In a true emergency where baby needs to be resuscitated at home, we're not cutting the cord because, hello, baby needs support. Why on earth would I cut off its oxygen line?
Mm-hmm.
We are going to keep baby beside mom. We can do whatever we need to do. And at home, midwives will do this as well. But in the hospital, it's cut the cord immediately to do whatever they need to do. But yeah, this is so important. You've probably heard like golden hour
Mm-hmm.
of like, mom and baby stay together at minimum for the first hour. I mean, I'm like the golden month. I'm like, I don't think unless the mom is like taking a shower and dad wants to hold the baby, I don't think anyone else needs to hold the baby at all. And I know everyone's like, oh, my mom really wants to hold the baby. Oh, my sister. It's like, well, again, baby has absolutely no freaking clue that they are detached from the mother. And at any point that they are, this is problematic. And there's so many conversations we could go down on like co-sleeping and just like being naked at home as much as possible post-birth.
Yeah.
Like baby naked on you, blankets on top. There is no greater place. There's no safer place for baby, period.
Yeah. I have like all these topics. Like, I really want to get a co-sleeping expert. I really want to get like an EC expert, all these things, right? So I've been working on that. And I love that you touched on like having other people hold baby, because even for me, like I've gotten a little bit of pushback where I've told people like I actually don't want to pass my baby around when it's born. And they're like, you don't know how you feel. And I'm like, but like this,
Yes, I do.
yeah, I'm like, this baby is alive now. It's like in my body now. I feel connected to it now, and I do know how I feel. And like people, I think people forget that like you are a mom when your baby's conceived and that intuition kicks in already. And like to me, I'm like, it's not like, oh, the baby will come and I'll have these feelings. I'm like, in my mind, the baby's already here, already exists, and I have these feelings and I feel very strongly about it. So I don't know. I'm definitely not going to be the person that's like passing my baby around like a party favor. And I think that's fine. I think that's also just like, it's intuition. It's a very maternal intuition, and for me it's like if something doesn't feel right, I am not going to do it. So and then with like the vernix, right, like a lot of people get their baby cleaned right after birth. Why would you want to wait, and how long do you want to wait to bathe your baby?
So, in my opinion, I don't think you need to bathe your baby for like first month, honestly.
Amazing.
At minimum a week. At minimum a week. And so that beautiful vernix, which is that nice, thick, creamy texture on baby immediately post birth, which the longer that you're pregnant for, typically there'll be less vernix. So if you give birth at like 42 weeks, the likelihood of your baby having a lot of that vernix is very low because they're like very ready to come out.
Mm-hmm.
And so, why we want to leave that on is because it is baby's skin's protective layer. And it is insane how quickly that it absorbs. Like, you will be shocked within minutes. You're like, oh my gosh, baby came out nice and white and creamy a minute ago. And now all of a sudden it's gone. Like,
Wow.
it's bizarre. You will see. But it's beautiful. And oh my gosh, the amount of amazing ingredients that are inside of that vernix that is protecting and nourishing baby's skin's microbiome is like the most elite skincare that babies
Mm-hmm.
have in their life. If I could bottle up vernix and sell it, oh my gosh, Tala Twins to the moon. It would be crazy.
I love that.
So yeah, that is non-negotiable. I am so anti like wiping baby down. This is not ideal. And also on the note of not cleaning baby's face, when baby is born, it is a very instinctual, primal, and just intuitive moment that you will have with your baby where you will kiss and smell your baby. You'll kiss and smell your baby. And there's a chemical reaction that happens from the amniotic fluid on baby's head that interacts with your mouth and your lips. And it basically tells your body, okay, baby is born, baby is here. It's time to release the placenta, continue contracting, start producing the milk. It is showtime. The birth is over. We don't need this placenta anymore. And out of round, I think the average is about 36 minutes post birth. Think about what you're doing 36 minutes post birth. You're cuddling the hell out of your baby. You're sniffing the hell out of your baby. You're kissing them. You're having the most like euphoria you've ever felt in your life. Like ayahuasca ceremony could never. You are pure bliss, cloud nine. And at that 36-minute point, we have a natural spike in oxytocin. We will hit the peaks of oxytocin right then and there. And that's typically when the placenta will release. Oxytocin is going to influence more contractions to get the uterus to shrink down in size, and also to release that placenta that is on the inside of your uterus, like so. It's basically going to peel off like a scab, and it's going to slowly come out, and then you'll deliver your placenta. The birth is not over until the placenta is born. So the energy, the vibe, the sound, everything, all of the above must stay the same until that placenta is born. Because a lot of the times, especially in the hospital and even at a lot of births that I supported with regulated midwives, it's like, yay, everyone's talking very loud, baby's born, yay. But it's like, the birth is not over. We are not even close to being done. The placenta is here. The placenta can come within minutes or it can take an hour. In the hospital, they want it out immediately, and they will actually manually remove it. And that is typically why we see so many postpartum hemorrhages, because that's a big scab you're picking before it's ready to come off.
Yeah.
What happens when you pick a scab? It bleeds. What happens when you let a scab fall off on its own? The blood is clotted behind the skin. Like you don't need a medical degree to like understand why birth just works so well on its own. And there's a million studies to back it. And I have had the privilege to witness so many different variations of birth. And I'm like mid 50s. I think I'm around 54, 55 births. I just, as of lately, like wrote a list. I'm like, okay, how many births have I actually supported? And I think I might have forgot some, but I'm at 54, 55 is what
Amazing.
And they're all very different variations. And what I've seen the most is that the less that is done, the smoother the births go. And
that makes sense.
It just makes sense. I've seen a number of emergencies, but each one of those happened within a hospital setting, and I have not seen any at home. So
yeah,
that's all I can say.
Yeah, absolutely. And, I love this. Like, and I love how you mentioned you don't need a medical degree to understand why birth works, because, one common pushback I get, and I'm sure you get time to time, is like, well, are you a medical doctor? If so, please provide your license number. And I'm like, okay, well, doctors aren't really trained to support the physiological process of birth. They're trained to intervene. Let's start there. Second of all, they're like, when somebody says that to me on any topic, I automatically am like, okay, what I hear is you outsource all of your intuition. You outsource your autonomy. You outsource your wisdom. You've never researched a thing in your life when it comes to your own biology. And that maybe sounds harsh, but I don't want to only have secondhand decision-making, secondhand knowledge when it comes to my own body. Right? Like, I will research everything. I like to look at both sides. I like to understand what's going on. And I think that if more people did that, like, it would be such a better world, because people would actually have autonomy, and we could like take the power back, and you can make informed choices. And, person A's informed choice might be different than my informed choice. And that's okay. Like, newsflash, it's okay. And I'm holistic for me. And yes, I think everyone could benefit from being more holistic. But I don't care if somebody else decides not to be, but I at least want them to know why they're doing what they're doing and why they're opting out of the other thing. And so I think that, like, ultimately birth, while I have met people who have had truly like emergency situations in birth, and I have so much compassion for that. And like, yes, of course you went to the hospital. Like, this crazy thing happened. Normal healthy birth is not a medical emergency. Normal healthy pregnancy is not a medical emergency.
Mhm.
And like people don't like to hear that, but it's just the truth. Okay, last question before we wrap it up. Because we're on the topic of the placenta. Are
Mhm.
you team take your placenta?
I am indifferent.
Okay.
There's not enough studies out there for me to like pull any claims out of my pockets here. I think if a woman feels as though she wants to take her placenta, I'm like, let's go. I know I'll connect you with the gal that encapsulates it for you.
Yeah.
And then there's also a lot of women that want to just keep it and chop it up in tiny small pieces and maybe add a little bit in a smoothie or something. Um, Again, I'm not pro, I'm not anti. I feel like when it comes time for me, I'm probably not going to ingest it, but I will absolutely be keeping it and maybe planting a tree over it or something really cute. So that can be
Yeah.
like my baby Brooks. That'll be baby Brooks tree. And then there's a couple other things that you can do with your placenta. If there's a situation where a woman is at home and she is bleeding a lot more than she's comfortable bleeding and she's feeling a little bit more faint and there are obvious signs that's like, okay, yeah, I mean it's birth, you're losing blood, this is normal. There's something called cheeking the placenta, which basically you can take a piece of the placenta and put it in her lip, and basically similar experience to like when you're kissing your baby and there's an amniotic fluid chemical exchange. Similarly, that'll trigger the brain to be like, okay, we need to clot this blood. The placenta is born, and that will kind of send like a supercharged response to the uterus to clot the blood. And obviously that's like layman's
Mm-hmm.
terms, so a lot more scientific research as to why that is helpful. And if you think about what animals do, every single animal on the planet eats their placenta except for humans. So that's why I'm not anti. I'm like,
Yeah.
I think if you feel the urge or you feel like you want to, do it. Absolutely do it. And also, like, these organs are extremely stem cell rich and have a whole lot of wonderful nutrients in them.
Yeah.
So I don't hate the idea, and I can't say that I'm not going to do it because I very well might. But I'm indifferent. I'm supportive of either side because I do think that there can be a lot of benefits. And then also lastly, if mom is at home and she tore a little bit, which tearing is not an emergency. I'm like anti stitch when you do tear. I'm like, let the body heal the way that it will. If I'm trying to like play God and stitch the body, like if we just have a tiny little tear and I'm trying to like make it perfect, like no, the body can heal. Let the body heal. You know, vaginas are quite literally built in a position to tear open wider, and they will heal. And how will they heal? If you're not walking around, if you lay down, if you keep your legs closed.
Mm-hmm.
But using the placenta, you can also cut it in strips and leave it inside of a pad. And that can also help with healing for the first few days as
Oh,
well. So,
fascinating. That's
mhm.
so fascinating. Yeah, because I've been trying to decide what I want to do with it. Like, I've always thought I would take it, and then I'm like trying to like, I'm thinking about do I really want to? And I know that I've had friends like with just the hormonal drops that happen. They think it's helped them a lot. The only thing I know for sure is I'm not going to let it be sold off by the medical system. Like, all I know is it's coming with me, whether it's getting
Mhm.
encapsulated or I put it in tea. Like my TCM doctor was like, you can like stew it in tea, and I'm like, I kind of feel like I'm somebody that I love taking organs. I love doing all that, but I kind of need it in a pill form. Like I do get
Yeah.
like a gag reflex, and I
Mhm.
know that makes me maybe like not as crunchy or like whatever, but like I'm not the person that's like swallowing like a jiggly raw liver. Like I would love that. I have a really bad gag reflex.
Yeah.
So I
I'm
might get
right there with you.
encapsulated. Yeah. And I'm like I personally that's how I take it to make sure I get the nutrients. So I feel like if I do take it,
Mhm.
it'll be like that because
Mhm.
I like if I start gagging, it's not going down.
Yeah, it's
But
not happening. You can
it's
also chop it in really tiny pieces and like cover it in melted cacao or something and then
oh, that's
swallow like
smart.
tiny little
Yeah.
your own homemade frozen capsules rather than like
Yeah.
getting it dehydrated and getting it encapsulated because obviously that does take a little bit of time as well.
And it's expensive.
Yeah.
Like it's just another cost. And I'm already like,
Mhm.
okay, everything's expensive. This is expensive. And when you're natural, nothing is covered by insurance, which is fun.
Yeah.
But that's a whole other rabbit hole.
Oh,
Um,
yeah.
Yeah, make little like placenta truffles. Like
Yeah, totally, like,
whatever.
small
Yeah.
enough so you can swallow them. I mean,
Yeah.
I pride myself, like, I can take, like 10 supplements at once, which is probably
Same.
I'm gonna choke one of these days. I need to stop doing
Literally
that.
same. I'll take like literally like 8 horse pills of like liver at in one gulp. I'm like, this
Yeah,
is weird, but
yeah. Sometimes I can feel them if they get a little caught. I'll just, like, eat, like, an apple or, like,
Mhm.
fruit or just, like, a little something with some substance, like a banana. It just pushes it right down.
Mhm.
It's just normal for me. I'm like, "No
Oh yeah.
panic. I'm just gonna eat something small."
Choking, don't know her. No, I'm literally the same way. It's so funny. Okay, Madison, I have loved this conversation and I feel like there's so many avenues and so many questions we haven't even gotten to. So if you ever
Mhm.
want to come back and talk about like actual like pregnancy tips or postpartum tips, like the door is open. I love this topic. I love chatting with you. Where do people find you and connect with your business? I know you're in Canada, but like if they either want to just like learn from you or if they're interested in hiring you.
So I am in Ontario and I travel around quite a lot in Ontario to support births. Um, to find all things birth related, you can find me at Mads Birthwork, Mads Birthwork on Instagram, but also on Twitter. The name is under Tallow Twins. I speak a lot about all things controversy, birth related, health related, recipe related. Love to yap on there. And then, of course, Tallow Twins on Instagram. Tallow Twins was born because of my birth work. I was making products for the moms and babies. Our first product, Happy Baby, is just a great one for all things postpartum, pregnancy, pregnant belly, chapped nipples for breastfeeding, and then, of course, baby bums and all things baby rashes. So, yeah, tallow is like the elite baby skin food. So, yeah, you can find all of our information there. And it was so fun chatting. I absolutely love talking about birth, and I'm so friggin' passionate about it. It's beautiful. It's so cool. I am just wowed by it every single day. And I actually have a mom in early labor right now. And
Wow.
so maybe I'll be catching a baby later. So this is so fun.
So exciting. Well, it definitely shows that you're passionate and you are such a wealth of knowledge. So, like, on behalf of all the women and hopefully their husbands that will listen to this too, like,
Hmm.
thank you for imparting so much wisdom. I feel like you hopefully cleared up a lot of confusion for people. And if they have more questions, like if you have more questions, reach out to Madison, connect with
Please.
her. What are your current health goals?
My current health goals. Oh my God, you asked this question last time. This
I
is so
know, but it's
good.
been like what, a year? So I'm like, wait, we
Yeah.
gotta find out. Has it
No,
changed?
totally. My health goals are pretty standard, honestly. Like, it's just eating enough protein always, which honestly, I don't think I have a difficult time doing.
Yeah.
And just like listening to my body. Just I'm really trying to connect with my body a lot more on like a somatic nervous system level, which is honestly new for me because it's always been like holistic. This is all the things I need to eat. But I realized I'm like, I don't know if I'm connecting with my body as much as I claim to be. So,
Mm,
full disclosure, this is the current rabbit hole that I'm going down, and like truly trying to communicate with my body on a deeper level, and also reminding myself at all times that um, less shame around how I'm treating my body is where it's at because as you know, being in this health space, it is so easy to get so overwhelmed by all the new, fun, cool biohacking, holistic, ancestral, all the things. When it's
mm-hmm.
like, do you feel good? Like some days you're gonna
Yeah.
be eating incredible. Some days you're gonna be taking care of your body and amazing, and you're gonna get all your 3 saunas a weekend and your lymphatic drainage and your dry brushing. But other weeks I might not do any of it.
Yeah.
So just being okay with that. It's a lot more fun and a lot more enjoyable.
Absolutely. Yeah, if your wellness routine is stressing you out and it's becoming rigid, like it's probably counterproductive,
Yeah, you're
which
missing the point.
yeah, I feel like I'm learning that too. So I love that. Like I'm definitely learning that in this season. Like bite-sized things, what's
Mhm,
digestible today, and it's
mhm.
not always the same, and that's okay. Well, Madison, thank you so much for coming on today.
Thank you for having me, Delaney. It's always so fun.
Love chatting with you. Well, you guys,
Yay.
thank you so much for listening, and I hope you love this episode. We will chat very soon.